This is Catherine Odom with a video about tube feedings, in particular gastrostomy tubes. Defining features. A gastrostomy tube, also called a G-tube, is a tube inserted through the abdomen that delivers nutrition directly to the stomach. The PEG procedure, which is the most common technique, uses an endoscopic, a thin, flexible tube with a tiny camera and light at the tip, inserted through the mouth and into the stomach to guide the doctor's positioning of the G-tube. Gastric tubes can last for more than a year before needing to be replaced. Replacing the G-tube is easily done by a parent or healthcare provider without another endoscopic or surgical procedure. After a few months of healing, your doctor may recommend replacing the longer tube with a button, a device that is flatter and lies against the skin of the abdomen. And here you can see a visual of the G-tube inserted into the stomach for tube feeding. The teacher's role in tube feeding. Teachers should place all medical information for the students with feeding tubes in an IEP or 504 plan. Teachers and staff that will give feedings to the child should be required to receive training from either a certified person such as a nurse or parent. Teachers and staff are required by law to provide feedings to the student who attend school with feeding tubes. These students should still be served in the least restrictive environment. Educational implications of a feeding tube. An individualized education plan, or IEP, or a 504 plan will need to be developed so that the child and all involved will be aware of proper procedures and protocols for the G-tube. The IEP or 504 should address all issues related to the G-tube regarding time of feedings, how much feeding or food to give, who will give the feedings, who will provide the feedings, and what to do in case of an emergency. For example, I had a student in my class this past year who had a G-tube that was not being held in place by the balloon. It was deflating and kept falling out, and we had to call her mother to have her taken to the hospital to have another G-tube put in. The feeding tube should never be the decision-making factor in deciding the child's least restrictive environment. For example, I work in a severe profound classroom, so students in my room that have G-tubes also have cognitive delays, whereas someone may just have a feeding tube and may not be required to be in a severe profound classroom. Specialized training needed. An unlicensed assistance personnel, or UAP, can perform G-tube feedings after being properly trained by the school nurse or person specified in the county. Delegation of the UAP, or unlicensed assistance personnel, is a process whereby the nurse retains accountability, such as documentation and training, to assure that delivery of care is implemented safely and effectively to produce positive health outcomes and enhance the student's learning. Resources for parents. You can check out the following resources if you have any more questions about tube feedings. FeedingTubeAwareness.com, the Olay Foundation, Feeding Matters, and We Nourish. These resources will provide information about how to raise positive awareness of tube feedings and help parents obtain knowledge and practical knowledge and support they need. It contains video libraries, online community forums, regional supports, annual consumer conferences, and more. And there's also an article on to tube or not to tube, which gives positive alternatives to tube feeding if you so choose to take that route. Thank you, and have a nice day.